We have with us today for this conversation on innovative solutions to address violence against women and children during COVID-19 and importantly beyond, Flavia Bustreo, who's the co-chair of the Lancet Commission on Gender-Based Violence and Maltreatment of Young People. Welcome, Flavia. And we also have with us Michelle Remy, research lead at the United Nations University's International Institute for Global Health. And we're just very delighted to have both of you join us here today. So let's just make one last call for the poll in progress. Last chance to note your response here. Has violence against women and children during COVID-19 increased, decreased, or about stayed the same? And let's close it off here, Damien. Looks like the clear lead is increased. So 63% of you said it's increased. 26% of you said it's decreased, and then a couple folks who believe it stayed about the same. So thank you for doing that. And with that, I will turn it over to you, Flavia, to get us started. Welcome, and the floor is yours.
Thank you so much, Elise. And it's great to be connected with so many of you during this 2 days virtual summit. So we thought we would start this session by recapping what do we know about violence against women, against children, and against young people in normal time, and also what do we know about violence during time of crisis and pandemics, and what do we know about this particular pandemic we are in. And I will cover this, and Michelle will cover more. What do we know about innovative solutions that are seeing around the world and that are working? So the global statistics are truly staggering, because there is no other risk factors in global health that is so persistent and pervasive and perverse than violence against women, against children, against young people. We know that more of a third of women and girls during their lifetime, 1 out of 3 during their lifetime is subject to violence, most often violence by an intimate partner. We also know that nearly 1/4 of all adults worldwide report having had physical abuse as they were children, and then also that the lifetime prevalence of childhood sexual abuse is unacceptably high for both sexes, higher for girls, around 20%, than for boys, around 10%. But we also know that this intergenerational cycle of violence and trauma can cause a legacy of suffering, and multi-country studies have shown, for example, that boys who witness their mother being beaten are more than 2.5 times likely to be perpetrator of violence against their own partner. And yet, country-specific data, differentiated by age, considering all gender identities, are really required to monitor the progress, but we know they don't exist in normal times. Now, what do we know about the impact of crisis, in particular socioeconomic crisis and public health crisis? This intersection is an intricate, yet it is a recurrent one. So it's a relationship that is linked to several factors, including, for example, the inability for women to access and reach work during the time of crisis, the redundancy that they are often experiences, the temporary food insecurity, all can increase stress for future economic security, and also can lead, for example, women to poor coping strategy, behavior that in turns are linked to different types of violence, including substance abuse or taking on debts or transactional sex. In addition to that, poor mental health and special mental disorders and related factors, including alcohol and substance abuse, have been shown to increase the incidence of violence against women and violence against children. And they have impact, particularly during this time of quarantine. And such a situation is really accentuated and exacerbated by the COVID-19. We know from previous pandemic that, for example, from the Ebola pandemic and also from the cholera outbreaks, that levels of gender-based violence and violence against children increase. But this uncertainty about this pandemic we're living, the COVID-19 pandemic, and also the extreme measure of lockdown that we have witnessed, they have increased. Anecdotally, we have a lot of evidence that this increase, that they have meant for women and for children to be locked and to be living in a very small space in the household, very often with perpetrator. And what we've seen is, for example, from China, from the Hubei province, an increase in the calls in the hotlines of 40%, higher than 40%. This is, for example, in Australia and also in the UK. However, one important message that I like to convey is that these are anecdotal data. And despite the fact that during COVID-19, we have had a huge number of publications, we have seen the number of publications increase dramatically. We do not have a lot of publications that document this increase. And we are left really to address this problem without the measurement that is required. And I'm surprised by the poll, Elise, because in many, many countries like my own Italy, the attention to this problem has actually decreased, has almost vanished. In Italy, before COVID-19 epidemic came, every day in the media, in the public discourse, there was a lot of discussion about feminicide that was happening almost every day. But since COVID-19 is present, these issues of violence against women and violence against children is almost disappeared by the public discourse, is not been addressed by the technical task force, which, by the way, is composed only by men, and it's really not visible anymore. And therefore, the response is not happening. But we don't want to have a message that is only negative. We want to discuss and ask you, and we will start with hearing from Michelle, what can countries and community do to prevent violence during the time of pandemic and also to respond and mitigate? Michelle, over to you.
Thank you, Flavia. And hello, everyone. It's lovely to be connected. So I'll be speaking a little bit about what countries are doing in response to violence against women and children in the context of the pandemic. You know, the increased risk of violence during this pandemic has made the headlines globally and in many countries. So it is on some agendas, at least, and in the mainstream media. And GBV messaging is even being integrated in COVID-19 messaging in some countries. And this is the result of, you know, the tireless efforts and advocacy of women's organizations and women's voices around the world. And I think it is a critical achievement and a critical first step that was lacking in previous pandemics and crises. But then what action are we seeing? At the United Nations University, we've been trying to track policy responses to COVID-19 across sectors, and from available government announcements, media reports, and other monitoring that is done by other international organizations, we see a number of measures to respond to the needs of survivors of violence. You know, will no doubt have heard about additional hotlines, WhatsApp numbers, signal alerts or code words for survivors to call for help and trigger the domestic violence response services in their location. Digital innovations that were already mushrooming in the area of prevention and response to violence are increasingly being relied upon for women, at least for women with access to mobile phones and internet. And this includes both alert systems as well as online services, psychosocial support, and others. While it was a struggle, shelters and crisis centers were eventually included as essential life-saving services in some countries during the lockdowns and the movement restrictions. Hotels and other spaces have been repurposed as temporary shelters for survivors and their children in a number of cities, so ranging from, you know, Argentina, Russia, and Belgium, among others. Then there was the issue of survivors being able to access justice, and to maintain their access to justice services. Several countries have shifted legal and justice services online. violence against women and children cases, including virtual courts, online legal counsel, and police services. So in Peru, for example, there was a decree allowing for technological resources to be used for immediate communication between a survivor and a judge. Now, that's been mainly about how we respond to the immediate needs of survivors and make sure they get the support they need. But then what is happening on the prevention side? So to prevent violence from happening in the first place, the most significant policy response we're seeing is probably the cash transfer programs and financial assistance schemes for low-income households that are being rolled out or expanded across most countries. I think according to the last count, 126 countries have put in place some kind of schemes, social protection schemes. And this is either in the form of unconditional cash transfers, food vouchers, or unemployment insurance. In the Philippines, for example, the reported social protection coverage has quadrupled from compared to pre-COVID-19 levels. And while these are not primarily interventions to prevent violence, we know that they actually do work to do that, just that. So there is evidence, robust evidence, linking cash transfers as a form of economic strengthening to reductions in intimate partner violence in low and middle income countries. There's also some evidence from high income countries suggesting reductions in child maltreatment. And they've been able to reduce, intimate partner violence by as much as 11 to 66%. So it's quite significant. And what seems to be the most common intervention that we're seeing is media campaigns, mainly to raise awareness about the support services that are available. But some of them also aim to prevent violence. So some of them are promoting more gender equitable norms, peaceful conflict resolution, and healthy parenting. And you can see why these would be used so much, right? They can reach a large number of people at a relatively low cost, and they're very visible interventions. But unfortunately, from the evaluations before COVID and what we know about social marketing and educational campaigns, they've not been found to be particularly effective tools to prevent violence. It may be very important to make sure that survivors are aware and know where they can access services and help, but they've not shown to change violent behavior. And they're unlikely to be a solution, at least not on their own. But they may be part of a solution if combined with other interventions. So that does raise so this is sort of what we're seeing, what we've been picking up on. And I'm sure there's more going on in country. This would focus mainly on government responses, but it's also, it begs the question of what are we not seeing enough of, or maybe not yet. And we have several effective tools in our toolbox that's been growing over time, over the past 15, 20 years. We know more and more and better how to respond to violence and to prevent it. And many of these that we know work are not being prioritized at the moment, at least not by governments, and not at scale. There are some obvious reasons. I mean, most of the models that we know work to prevent violence were not designed to fit the current reality of social distancing. So things like community activism, couples interventions, group-based education on gender, on power, on parenting that require face-to-face interactions, school-based interventions. But what is promising is we know these approaches work within programmatic timeframes, and now they need adaptation and innovation to preserve the active ingredients that we know have made them work, and while re-engineering them to fit into the new normal and for them to be delivered at the scale that we need them to be delivered at. I think it's an exciting thing that we're not starting from scratch. There's not a lot we know and we need to build on to make sure that we're using all that knowledge that has been documented and the lessons that have been learned. But doing this at the scale that we need to match the problem will require significant investments. And I don't think we're seeing that yet. Policy commitments are one thing. Actual resource allocation and implementation are quite another. There's still many questions as everyone is responding in real time, and we're really keen to hear from all of you in this conversation how your countries and your communities have responded, whether you think the response has been adequate, what innovations you've seen or have been implementing yourselves, what you're learning and about what's working and what is missing. And before I end, I just wanted to add a few things that I'm particularly interested to hear about from all of you as well is innovative responses and protective services for children and adolescents. I've spoken mainly about approaches in response to violence against women, and those have seemed to be a bit more in the in the eye, but very keen to hear about those, and particularly efforts to integrate interventions that tackle violence against women and children jointly, and really optimize the synergies there. And the other is we're talking a lot about violence in the home for obvious reasons, but there's also violence outside the home, online violence. We're seeing some disturbing reports of increased cyberbullying and harassment, and also violence against predominantly female healthcare workers. So I will stop there and look forward to the conversation.
Wonderful, thank you both. So to get us started here, Damien, let's launch the second poll. Whoops, there we go. All right, so we've heard some of these things, but we're curious to know from you, what policy measures have you heard of being implemented in your country or community to respond to violence against women, children, and adolescents? And with this one, you can choose multiple answers. So media campaigns to raise awareness, media campaigns on positive gender norms and peaceful conflict resolution, hotlines, temporary shelters, digital remote access, cash transfers. And then if you have something that you're seeing in your community that isn't listed here, please chat that in. So please type into chat anything that you're seeing that is not already on this list. So we have about 18 votes now, 20. The answers are coming in fast and furious. In the meantime, I'd also invite you all to chat in any questions that you have for Flavia or Michelle, and or any insights you want to share of your own. I think we're a small enough group that when we're through with this poll, we can also open it up to some direct questions. I would just ask, if you have a question, there's a way that you can sort of raise your hand over in the participant bar. So if you would just raise your virtual hand if you have a question, and we'll be able to manage the conversation that way. So we'll take a couple more minutes here to leave the poll open. We have about 33 of you who've responded. So if you haven't, please do type in your response here, as well as any questions that you have in chat. All right, so it looks like, I'll leave this over for just another minute, but it looks like there's quite a lot of happening with media campaigns to raise awareness about violence. And then also another one is sort of hotlines and signal alerts. So let's go ahead, Damien, and maybe close off this poll and see where we've landed. We didn't have everyone respond yet. Okay. And maybe this is a good place to start, Flavia and Michelle. So can you both see the poll results here up on the screen? So it looks like, yeah, it looks like clearly we have something around media campaigns and then hotlines. I wonder just what the two of you make of these poll results, if there's anything that, that you would draw from what you see here. Is it surprising to you, or does it fit basically what you're noticing as well?
I think it fits what we seem to be hearing and seeing in the media. So quite a focus on the immediate, response for survivors, which makes, is critical, makes a lot of sense.
Yeah.
Yeah.
Okay, fantastic. And so folks, please do chat in your questions, and or invite anyone who would like to ask a direct question to please jump in here. And then maybe I'll just get us started off. So I was interested in the comment that you made, Flavia, early on about sort of breaking the cycle of violence. I wonder if you could say more about that, and if there are any things either of you are seeing that help to do this. This seems like a really, really big problematic issue that's maybe hard to address.
It is hard to address, Liz, and especially what we have seen during the current situation, that in addition to violence, we also have children that are suffering from, like for example, the data that were published from Hubei province in China have revealed that around a third of children after the lockdown ended at symptoms of post-traumatic stress disorder. So we are seeing that during this time for children it's very hard to cope, and it's very hard to have to grow up with your affectivity and within a home and within a household that is so disrupted. So that is where if children are also exposed to violence, and particularly domestic violence, that is likely to have repercussion not only in their life currently at the stage, but also they will carry that with themselves as adults. One thing that it's very important phenomenon that we didn't quite stress in the initial introduction, primarily because we do not have a lot of data. I think I said that, but it is the phenomenon of cyber violence, and how much children and especially young people are affected by these, especially at this time, because life becomes virtual in many ways for many of us and also for young people. And therefore, all the phenomena of sexual exploitation in a virtual way, we have seen rising reports of these. I wonder whether also people have something to say about that, because these are areas where it's very hard to have hard data.
Yeah, absolutely. So those of you who are with us, we invite you to engage directly. So to Flavia's point, I wonder if any of you have seen anything with regard to, sort of what's happening in the cyberspace. Here we are all meeting together in a virtual world, and it offers great possibilities. And at the same time, to your point, it exposes things. So folks here in the breakout room with us, what are you noticing about this? You're welcome just to turn on your video and unmute and make a comment directly here. If we don't have any immediate comments on that, we do have a question here in chat. So even if there are interesting interventions on the ground, accessibility to these services has been an issue, especially in India. How can monitoring plans work? So Michelle or Flavia, would one of you like to take that?
Sorry, I'm trying to unmute myself.
No worries.
Go ahead,
Flavia. Okay. No, I think this is a major issue even in non-COVID times, right? There are services that are available in principle, but they are very difficult to access. They are not delivered at the scale required. They are geographically quite concentrated, and I think this has been a problem for a very long time, and in range of contexts, and I think it's only been exacerbated now, clearly, in terms of all the additional restrictions, all the additional considerations in terms of when accessing services, and also for specific groups such as migrant populations in many countries. They have other concerns and legal barriers that make it even harder for them to access services. How we can be monitoring that better. I think from my experience, working in a number of countries, there really seems the main issue is that there are not enough resources being allocated towards these things, and they are not equipped, sufficient service providers, resources to reach out, to be able to go and when women call for help, to go out and reach them and provide the services. So I'm not sure I really have answers there. Perhaps Flavia, beyond investments and actually taking this seriously and putting the resources there to make it available. And of course, there's the whole issue around, even if they are available, women being able to get out of situations and safe enough to reach out to those services. So that's a further issue.
All right, thank you. We have another question here from...
maybe there is one more aspect I wanted to stress, Elise, which is we haven't quite touched upon, but we know from previous crises, for example, we know from Ebola in Sierra Leone, that violence against healthcare providers, female healthcare providers, particularly nurses and midwives, escalated. And even after the Ebola epidemic in Sierra Leone, for a long time, community midwives, for example, were not able or they were not willing anymore to operate alone in the community because they had been targeted by violence. So what we wanted to hear is that in your countries, in your community, are you seeing this in this? Obviously, this is different because the mobility of community workers is limited, but are we also seeing violence, gender-based violence against health workers? This is particularly relevant to this comment and question, Elise, because we know that 70% of the health workforce around the world is female. So we need to consider that this 70% of the workforce is responding to COVID, and in that response, are they also subject to gender-based violence? That's the question.
So I think that, yeah, that's a question for the group here. So what are you all noticing in this regard? And again, we invite you please to either chat in your comments, or you are more than welcome to unmute and just share with us what you're noting. Yes, please.
Yes, thank you so much. And I'm happy to be here. I thank the organizers. It is a very good interaction. I'm speaking from Nigeria.
Whoa, that beach is wonderful.
Are you really at that beach? It looks amazing.
So it's virtual. So in Nigeria here, we have so many, I call it pandemic in pandemic. Pandemic in pandemic. There are rising cases of domestic violence. It is very high in Nigeria here. Yeah, maybe I will look for the link. I will share with the group here. There's recently a man murdered his wife and later took his life over DNA paternity issue. But the woman has suffered so much domestic violence in the past that she was hiding it from the families and the public. The problem we have in Nigeria is that most women are not reporting what they're passing through in the hands of their spouses. They're not reporting what they're passing through in the hands of their spouses. My organization has been very working hard on this, trying to encourage the women to be bold, to come out and speak out. Because it's only when you inform the public that you are, there's a violence going on, you can be rescued. Most of them, because of the cultural reasons, religious reasons, and stigmatization attached with separating from your spouse. You know, in this part of the country, culture, tradition, religion is a little bit strong hold on the female. And they cannot come out. They feel that, if I divorce my husband, I'm a failure. You see that feeling? And the society will not accept them. I'll become a single mother. I'll become a divorcee. But life is more important. Life is more important. Because most of the women that were able to speak out, we found out that we engage the psychiatrist to work on them. They are passing through a lot of mental disorder. They lost their self-esteem, they lost their ego, they lost their boldness. But what we are trying, what we find out that majority of the people that have been abused, that are victims, are people that are not empowered.
All right.
That are not empowered. So we are trying to empower them as a way of intervention. And also we have created a hotline where people can speak to us anonymously for rescue, especially when the case is an acute case. Thank you so much.
Thank you so much. So the importance of empowerment. Michelle or Flavia, any response?
I think there is an important aspect that has been highlighted here, also on the chat I've seen, but also in this comment that was made from Nigeria, which is some of the underlying basis for the violence resides in the patriarchal structure of our society, where the people with power take on violence against the ones that have less power. And also this concept that you have alluded to, and some others have written in the chat, that is called toxic masculinity, which is that basically we bring up children, particularly boys, with the understanding that being powerful, attacking others, the most vulnerable, means being men. And there are some programs that are happening, and we don't know how they're working now during COVID-19, but there are some programs that are really trying to tackle that, both within the family and the community, but also at the school, at the formative time, at the formative age. And that is why it's particularly important that the breakdown of school during COVID-19 is affecting children even more, because school could have this mitigating effect, but currently in many parts of the world, schools are not operating. So that is that's a critical aspect.
Okay. I'll invite other questions for Flavia and Michelle. I have another question. So disruption obviously is traumatic, and at the same time it provides opportunities. So I'm wondering if there are some things that in particular stand out to you as opportunities coming out of this you know, enormous disruption in all of our lives.
Yes, I think yes. You know, everyone says never waste a crisis, and as devastating as the impacts are and will be of this pandemic, it is an opportunity for change and transformation. And I think it has, you know, so far I think there have been some shifts in certain discourses. There has been some additional attention to inequities and social injustice. You know, from the race injustice that we're talking about, and also I think a lot of issues around gender-based violence have come out. And so this is really an opportunity to speak up and to build back with equity and justice as priorities. And I do think it, you know, I want to be optimistic and hope that it could be a turning point for the acceptability of violence against women and children, and the recognition in particular of this being an imperative that really needs real investments to end.
I think, you know, Elise, I think we really need the voices of all the people that are here with us, and also we need to speak up loud and loud and loud, because in many parts of the world, COVID-19 is actually exacerbating the existing inequities, exacerbating gender inequities. You know, in many countries, the task forces that were set up for addressing the problems, they don't include women. There is very, very limited participation of people with different gender identities to the discourse of how to cope. Discussion around sexual activities and sex are marginalized. In a video here, in this that I recorded for this summit, I have said there is no lockdown for sexual and reproductive health and rights, and yet it looks like the lockdowns are closing down on these aspects of our lives. So I think we really need to speak up, because in fact, this crisis has a potential to accentuate the phenomenon of violence against women and violence against, particularly against young people that are left. And it has also the potential for not enabling the voices to be heard, because the current discourse is dominated by other imperatives, namely the imperative of economics and the imperative, I mean, if we look at how our leaders, particularly some of our main leaders, they talk about this as a war, they're fighting a war. And so I think we really need to use opportunity like this one and the summit and the networks like the one that we currently have. And also we are hoping that we can use our Lancet Commission to expose some of these, because otherwise we might find ourselves in a worse situation than we were before the crisis.
Wonderful. So this is actually a great segue to a question here we have about the Lancet reports, and that is, how do we translate the Lancet reports into country action? So the note that, you know, sometimes they're high level and, you know, perhaps the translation to country action and changing policy is, you know, is question.
Yeah. It's an excellent question, and you know, we have just started. Actually, we were supposed to have our first meeting of all the 30 plus commissioners that we have. We were supposed to have that meeting in London in March, and then of course that did not happen. So we are operating virtually like everything else is happening these days. And we're thinking hard, because we are not just interested in a 30,000 words report that appears in the Lancet. So we are thinking hard, how do we set up first the evidence and the thinking, but also how do we reach out to the policymakers, and how do we have, what are the policy levers, what are the advocacy activities that we need to undertake in order to change the situation. And any suggestion you might have is very welcome. We're thinking to set up what we call a policy governance and advocacy group, and we have asked the chair of the Partnership for Maternal, Newborn and Child Health, Ms. Ellen Clark, to chair that. Also, we are working with some senior women within the United Nations, like Anita Bhatia, the Deputy of UN Women. And we are thinking, how do we use opportunities of multilateral meetings where the policymakers are sitting at the table to try and influence their decisions with the recommendation that the reports will make. And we are also looking at what other previous commissions have done and what have been the mechanisms that have worked the best.
Wonderful, thank you. So I see Aaron J. has a hand up. So please, if you have a question.
Yeah, hi. Thanks, Flavia and Michelle. This is really, really informative. I just have a question about marginalized groups within just the category of women, like indigenous communities across the world. For example, in Australia during swine flu, during H1N1, there were reports that a lot of the funding that was given to safety centers and treatment centers for indigenous women specifically, they were the first to be closed down when money was being pulled back from social initiatives to repurpose it for pandemic response. And I'm sure similar things are also happening during the coronavirus currently. So my question essentially is for communities that essentially, for people who essentially face multiple layers of discrimination by virtue of their demographic beyond just gender. How should policy discourse go about discussing this, and how should government policy specifically look beyond just women in that sense?
Shall I try? And,
yeah, please try.
Answer that, Michelle?
Yes.
It's a very deep questions to which I don't think we have a full answer, to be truly honest. For example, we have interacted recently with the High Commissioner for Human Rights, Michelle, former President Bachelet, and she had indicated to us that all the special rapporteurs that are part of the human rights archipelago of instruments, they are reporting incidents of violence against people with different gender identities, for example. That seems to be one aspect that have not been, highlighted and put as a spotlight for policymakers. And as you said, the different aspects of inequities that currently exist. I'm thinking particularly all the migrant population that exists, people that are in refugee camps that are still living during this pandemic time. So I think the only way that we can address that is to have a full definition of gender. That is, we are not using gender as a synonym of talking about violence against women. We're looking at every phenomenon, every aspect of violence that has a gender element. So that is to make it explicit, and we are intending to do that in our commission. But also, I think we need the non-traditional voices also to come in on this space, because so far, if you look at the panorama of the organizations and the institutions that are very involved with this, you see there is a lot of female leaders that are talking about these problems. I think we need voices like your men. I think we need the voices of the indigenous people. We need to have the voices of also of the people that have been, to some extent, the ones that have maintained these inequities. So this is hard. It's hard to achieve, and I am quite hopeful that we also need to have the disruptive power that young people and young voices can have, to speak the truth, to power. We need that at this moment.
So unfortunately, we are at the end of our time together, and I think that's actually a really wonderful note on, to end on. So it's the power of voice that helps us make change, and particularly the voice of young people. So with that, we are going to close off this breakout room. Damien will bring up a slide here. For those of you watching the conference, you'll go back to the website. Here's the URL again. This was a wonderful conversation, far too brief. Michelle and Flavia, thank you so very much for your time, and thank you to all of you who joined us here for the conversation.
Thank you.
Thank you, everyone.
Yeah, we look forward to seeing you for the rest of the summit. Take care, everyone.